You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. In his practice, he says people can walk in without teeth and walk out and on the same day have a full arch of teeth that don't come in and out. With us, we have an expert on the topic. He is board certified in both periodontics and prosthodontics. We have Dr. Bobby Birdi. Dr. Birdi, welcome to the program.
Hi, Randy. Great to be back.
Now, we had you on the show before.
Yes.
What's changed? Because you were like one of the busiest guys then in Canada.
Well, what's changed is, we're doing more things. We're treating more and more people, and we're changing more and more lives, to be honest with you. We're doing our best to try to help as many people as we can. So it's a lot of fun right now.
Are there a lot of people in Vancouver that are either headed to dentures or already wearing dentures?
Randy, you'd be surprised. I think that if we actually could put all the people that have missing 6 or more teeth, we could probably fill up, there's a couple stadiums in Vancouver, there's BC Place and Rogers Arena. We could fill up those stadiums probably 10 or 20 times over, just with people that are missing 6 or more teeth. Now, if you think of in North America in general, about 40 million people have upper and lower complete dentures. That's a tremendous number of people that we can help.
Now, if they're so good, okay, that means if dental implants are so good, why aren't all these people that are wearing dentures coming in and getting their dentures attached to something or getting dental implants?
After doing so many cases and treating lots of patients, placing thousands of implants, they've kind of told me and said, my patients have told me a lot of things and just conveyed to me that there are some things that were holding them back. That were just really holding them back in general, that was in general trying to, preventing them from coming in to see me. So one of the major things is, denture wearers are in general uninformed. They don't know what's going on. They're not in the know-how, because when you wear a denture, you don't really come see guys like me. You don't
go to the dentist.
No, you don't go see
the
dentist. You don't see the dentist. You're not going to see the dentist all the time. And because of that, you're not in the know-how of implants or what we can or cannot do. And that's a big deal, because knowledge is power. And if you don't know, that's why I love being on the show, is because we're actually here to be able to tell people that this is possible. We do this every day. So for someone not to know that, that's one of the biggest hurdles they've got to get over. The second reason that a lot of patients, say that they didn't come in or was preventing them from coming to see us is really the fact that, how do you think a denture wearer got to being a denture wearer? How do you think they became someone that doesn't have teeth? It's not because they love going to the dentist. Most times they've gone through heck and back to get there. They've had a tremendous amount of trauma or just lots of problems by going to the dentist, numerous visits, extractions, hurt and painful procedures, lost teeth and root canals that didn't work. And in general, they're fed up.
So the last thing they want to do is see you.
Well, exactly. They don't want to see guys like me.
Do you still hear that, by the way?
Oh, every week.
Like, no offense, doctor?
Yeah, exactly.
Do they say that?
Yeah, the no offense, doc. You're a nice guy. You're nice and all, but really, I just don't like dentists. And I totally get that.
Do you have a comeback after all these years? You
know what? It's funny. I tell them I don't like dentists either that much. But to be honest with you, I have an uncle, an uncle of mine, and when I first got into dental school, he had grumblings about it, and when I went into pro school and learned how to make a really good denture, he came to me and he said to me one day, we're having dinner, and I see him cutting his pieces of food up in small pieces, and he goes to me, he says, when I had my teeth out, I was relieved. It was a relief to me to have all my teeth out. And I remember sitting back thinking to myself, well, why? But I understand that now after treating enough patients. Is because they don't want to keep going to the dentist. They're worried about all the little things and the little tiny costs along the way and the numerous visits and we'll try this, we'll monitor this and all those things. And in general, they're fed up and they're fearful of going into that process again. And that's difficult.
Now, but isn't it true, like for a denture, if you've been in dentures 30 years, you don't have enough bone to get this done? Oh,
that's absolutely not true. Absolutely not true. It's one of those things where I see that and hear that every week as well, where someone...
Oh, so you do hear that as well?
Oh my God, every single, when people come in and they say, listen, I've been told I don't have enough bone, I'm not a good candidate for implants, or I'm a diabetic, or I have osteoporosis, or I'm too old. All of these hurdles, they come in self-diagnosing. They come in saying, you know what, that's not for me. It looks great, but it's not for me. And the problem is that they're actually, wrong in what they're thinking, because we have yet to turn away a patient that couldn't get implants.
So what are you doing then that's so different than what another dentist would do if they say you don't have enough bone?
Well, first off, we're using newer technology. We're using CT scan technology and just using the best treatment modalities we can. A lot of the times, because we're doing everything under one roof or a one-stop shop, we're able to provide surgical and prosthetic therapy in one place. It allows us to really provide some of the best treatment out there and treat some of the most difficult cases. And to be honest with you, because we're teaching this and we're kind of trying to be leaders in this field, we're also treating cases in a much more cutting edge or leading edge area.
So when you say things like teeth in one day, we're talking about dental implants. That means they can go in with no teeth? Really? Like we said at the top of the show? They go in, and on the day of the procedure, they can walk out with a full arch of teeth, even though they had no teeth.
I did it yesterday, Randy.
Or what if they need extractions?
Doesn't matter. We do it every.
You can extract the teeth and give them teeth back.
When someone comes in for their first no-risk consult, they come in. We talk about things. After that, the next appointment, if their treatment's booked, they come in. Doesn't matter if they have teeth or not. Doesn't matter if they have dentures or not. We're able to provide them fixed teeth on implants in one day.
In one day.
Yeah, and I know that sounds kind of a little bit cliche and a little bit difficult at times, but to be honest with you, it's something we do every single day. And one of the other things that I think that patients deter from is the cost. Cost is a big factor for a lot of people. A lot of people think that
because insurance doesn't cover this here in the U.S. or in Canada.
Oh, insurance companies don't cover much in general when it comes to this stuff. They cover maybe some extractions, some other the small procedures, but no, they don't. But you've got to find value in things besides that.
Do you have financing and things like that?
We do work with some financial institutions to help with that as well, and we also work with patients' banks as well. Banks are really quite good in Canada helping out as well. But in general, the cost is a big deal because patients think that they need, if you're missing like a whole upper teeth, like you're missing all of your upper teeth, let's say, that's 14 teeth. They think they need 14 implants all the way up the mouth, and that's absolutely not true. We can get away with as little as 4 implants spread out throughout the arch and give someone 12 to 14 teeth off of 4 implants. That's
how soon can they eat after it's done?
That same day.
Really?
That same day, yeah.
So when they're all healed up, I mean, they could eat like whatever.
They can
nuts
a juicy steak, nuts, corn on the cob.
Pizza?
Oh, I love pizza. Pizza for sure, yeah. All those types of foods that you want to eat, there's no restrictions. That's the best thing. We want them to go out and eat, especially with the different materials we can use for their final restorations, zirconia and other materials. Really, there are no restrictions. They can eat whatever they'd like.
How old can you be to get this done?
I had a patient just recently that we treated, and she was 89 years old, okay? 89 years old, and she had been someone we've been treated for a long time. We've been maintaining her over time, and we basically decided that eventually all the laser therapy, all the different types of treatments we had tried already for her had got her to this point, but it was the end of the road. And
that means her teeth had to all be extracted.
Her teeth, many of them had to be extracted, and there weren't going to be very many left to build anything around. So yes, their teeth had to be removed. But she didn't want to have dentures. So we provided her fixed teeth in one day. We took out all of her teeth. We put in implants on that same day, upper and lower, and provided her with fixed teeth in one day. And she was able to smile and blow out the candles with new teeth for her 90th birthday.
So even at 90 years old, why would they want to do it at that age?
I think that a lot of patients, you and I don't really understand it because we take it for granted. We take it for granted about being able to eat and smile and talk, but they want to eat and chew like you and I, Randy. They want to be able to smile. They want to be able to talk to people, kiss their loved ones. They want to be able to do all those things and not worry about things. So when someone's 90, every single time, they all of them say, I wish I'd done this 20 years ago. I wish that I'd done this 30 years ago. I couldn't imagine what my life had been in my 50s if I had had teeth like this. And that's a great thing to hear.
So even if you're in dentures like 30, 40 years, you could do this?
Absolutely. We have patients.
Get your teeth back.
Exactly. We have some patients that come in that have had their teeth out since they were like in their 20s. And it's been 30, 40, 50 years they've been wearing dentures, and we give them fixed teeth in one day.
Are they skeptical, by the way, because they see maybe some of your advertisements that'll say teeth in one day?
I do hear that, Randy. People think it's a gimmick, and I have some patients that come in, and a few of them we've got photos of where they've had other things done, and we're able to remove or change everything and still give them fixed teeth in one day. And they think, well, can you do all that and really in one day? And we say, yeah. Watch and see. You're going to have a great result when we're finished.
You say that their lives are transformed by just changing their teeth or giving them teeth back?
I do believe that, and it's based on what my patients tell me after we've provided services for them. It's some of the things that are quite, just amazing to think about. 95% of our body's covered with clothing most of the day, and your smile is such a big part. It's like a welcoming mat for your body and for you, and it's a welcoming way for you to welcome someone into your being and into your space, and it shows. It's like a sign for you to say, well, this is me, and this is what I'm about, and I'm confident, or I feel good about myself. And so, if you look at surveys of what people look at in mates and spouses, and what's the most attractive thing, a smile is always in the top 3. And that's amazing. Right. That's amazing. So, when someone comes in and we're able to change the way they look, change the way they smile, they feel confident. They don't have to do this when they're speaking to people or when they're chewing. They don't have to worry about going out with their friends and going to places where they can just order specific foods and or order certain things that they can chew when their dentures rub together. All that parts, it's life altering. Randy, let me show you some photos.
Okay.
So here's a nice gentleman that we treated. He came to our office. It was referred by another office, and he was pretty much fed up. He'd been through a lot of treatment. He'd had everything tried, whether it would be surgery or laser work or whatever was possible, and he was fed up. He had trouble eating, bad breath, and in general, people had told him that he had to lose all of his teeth. So he was concerned about that. When he came in, we discussed all of his treatment options with him, and being a periodontal office and a prosthetic office, we were able to actually save all of his lower teeth, keep as many teeth as possible, maintain them. And yes, he had to lose his upper teeth, but we were able to provide him fixed teeth in one day. We were able to remove all of his upper teeth, place implants well spread out the arch, and give him fixed teeth. One of the biggest comments he makes now is that there's no sensitivity. He's not worried about the sensitive teeth that he had before, the bleeding gums he had before, the worry about, are my teeth going to move? Is food going to get stuck in areas?
So with teeth like this, could they bite like a carrot with their front teeth?
Yeah, they can bite. Well, he's got zirconia teeth, so he can bite teeth. He can bite carrots. He can bite, into a corn on the cob, a sandwich, a juicy steak, even peanut brittle. Things like that. He can actually.
So whatever.
Whatever. Yeah, and it's amazing. Like zirconia is a material that you could drive a truck over. It's amazing.
So they're shiny. They're white. Because it looks real.
Yes.
And the gums are just like what? Custom hand painted?
Custom made, and the materials actually custom molded for their mouth. All of the restorations we do are custom made for each person's mouth. So the right shade for that person, the right shape of teeth. Everyone has a say over the types of teeth they want, and we do a trying to make sure that everyone's involved and the patients really get what they want. We want to provide everyone with exactly what they want in the end, and in the end, it's whether they get that Hollywood smile or whether they have something that's a little bit more natural. We do a lot of natural smiles that are age appropriate and really give them the right shade for them, but we also do a lot of these Hollywood smiles for patients as well.
Anticipating you coming on the show, other dentists will tell me here in the U.S., Randy, teeth in the same day is a bit of an exaggeration. What do you say to that?
Well, Randy,
so you're doing it, you said.
We're doing it every day. We're doing it not just for full mouth. We're doing single teeth. We're doing multiple teeth. But I'm teaching other dentists how to do it all the time. So that's why I'm teaching them, is because I think a lot of them...
You're teaching them this same day.
Absolutely.
Teeth in one day
absolutely.
Concept.
Because a lot of them don't understand or are uninformed of what's possible. It's not a simple procedure, don't get me wrong, from a technical standpoint, so you've got to learn. But that being said, we're able to teach them and they're able to do some really good treatment. So in general, let's just show you another case.
Okay.
So this is a patient that came to me, and she's a wonderful lady. She's a great patient. She came to me because she had, I'm sure this happens in San Diego and other places as well. It definitely happens in Vancouver, where we have a lot of the dental tourism, where she flew out, she's from Europe, she went back to Europe to get her dental implants done, and she had numerous implants placed of a different type that, kind of the obscure kind, and when she came back, the dentist didn't want to see her anymore, and she was left kind of gumming everything all the time. Couldn't even wear dentures, and she had all these little implants underneath her gum tissue, and she was just distraught. She came to see us, and she couldn't believe that she was in this position, and she couldn't go back, and she was just she was kind of stuck, and she didn't know what to do. So we just discussed things with her and said, listen, it not only is that the problem is that a lot of this work has not been done well. A lot of the implants that have been placed are placed in incorrect positions or in places that we can't use them very well. So we discussed things with her. Her husband came in as well, and he said basically, I want my wife back.
Okay.
I want to get my wife back. She's not herself anymore. This is really stressful for her. So what we were able to do is we were able to provide her teeth in one day on her upper and lower arch, remove almost all of the implants that needed to come out, and give her fixed teeth in one day. And this is what she looks like now, Randy, and it's a night and day.
Wow.
Like, look at her smile. Like, she can't even, if you look at the after photo, when she smiles, you can tell it's a forced smile because she's not used to smiling that big because she's been used to looking the way. Same when she first came in, she was wearing, you know, like joggers and runners to the office. When she comes in now for her maintenance visits, because we're an office that maintains all of our patients afterwards as well, she's wearing her lipstick, she's dressed well, she looks good. And her husband, after we completed this all, he came and thanked me because he said, you know what, I have my wife back. I actually have her back, and he was so thankful, and that's why we do it. We do it.
So on the before, is that her typical smile?
That's her typical smile.
Like she's kind of hiding her teeth.
Yeah, so many denture wearers do that. So many people that have missing teeth do that, where they kind of train themselves, they practice in front of the mirror, say, okay, I'm going to practice my smile so I can show just enough.
Really?
But not enough that, you know, people are going to know something's going on. Absolutely.
When you say people like this are discriminated against, what do you mean by that?
Well, I think that if you look at the photos, right?
Yeah.
You look at her before photo and after photo. The before photo, you look at her and you think of, you know, you have misconceptions about her. You don't know what she's about.
Like maybe she's not educated or
whatever.
doesn't have money or whatever.
You could say that, but in general, you know, that's not the truth. She's a great lady. She's a wonderful lady, and it shows through on the
So one
photo.
afternoon this happens.
Yeah, and you know what's amazing about this is that it's such a testament to how you feel about yourself. You know, we talked about smiles and how much that matters, but this is a testament to her because she wasn't herself, and now she's ready to face the world, and her smile is such a big difference in terms of how confident she is.
Now what about pain?
That's a good question. I think that's another big...
Because it does seem painful.
Well, I'm sure it sounds that way. I'll tell you that most times when we do these types of procedures, if they're worried, we have different levels of sedation we'll offer in the office so that people can not remember and wake up and get what they need to have done. But in general, the pain we find for these types of cases is a lot less. It's a lot less because we're much more exact in how we're doing it. We're using computer-guided surgery and computer-guided prosthetics even to do things so minimally invasive that we try to be as atraumatic as possible.
So the gums, very little cutting of the gums?
In times, it's very little cutting, and in times, it's very little manipulating. And in general, because we're putting fixed teeth on, a lot of the pain afterwards is from the denture that they get when they get their teeth out, pushing on their gums. And when you have fixed teeth, there's nothing pushing on your gums anymore. It doesn't move. It's a fixed bridge. It's a fixed set of teeth.
So medications, if they need it the next day, next
Sure,
couple
yeah,
of days?
we provide patients with medications. A lot of times they don't even have to take the pain medications we provide them with. They're just okay with over-the-counter Advil or over-the-counter Tylenol a lot of times, which is pretty amazing.
Did they ever say like I was expecting worse,
Well,
or they were paranoid or afraid?
Sure. So I get that every week too, where they come back and they're pleasantly surprised. I thought, they thought it was going to be horrible. They've talked to some of their friends that have gone and had this done in other places, and it hasn't worked so well for them. And they're pleasantly surprised, which is quite amazing, which is quite flattering too. It's quite nice to hear.
So what are the options? Okay, let's say a denture. Okay, so somebody's headed to dentures, right?
Sure.
Their teeth have to be extracted, or they're already wearing dentures. What are their options in your office?
So in our office,
When it comes to dental implants.
in our office, we are an absolute dental implant treatment center. So we provide all options from as little as 2 implants to have in the lower jaw to have a denture snap in, snap out, kind of like the push buttons on a kid's shirt where they snap in and snap out. But those 2 implants act as an anchor, and that really helps to keep the denture in place. The problem with that is it's still a denture. You know, it still comes in, comes out. There's still food that can get underneath it. There's lots of adjusting to it. You still can get denture sores. It still rocks a little bit. The next option would be something with 4 implants. We can also have a denture that snaps in, snaps out, but we prefer to do something fixed at that point. Because like I said, we can do a fixed set of teeth with 12 to 14 teeth on just 4 implants. And that puts it in perspective. You went from 2 with a denture to 4, and you got fixed teeth.
A full arch of teeth.
That's right.
They don't come in and out, all in one day.
All in one day, teeth in one day.
And they can eat right away, even after the procedure.
Absolutely. We actually provide them with something to eat at the end of the appointment. We actually give them.
Are they afraid a little bit?
Absolutely. They're always afraid. They're always a little bit worried about things because, you know, it sometimes sounds too good to be true, and I can understand that. But we wouldn't be doing this if it wasn't working all the time.
So when they go from like this woman right here, okay, when they see their face for the first time with the new teeth, it's got to be emotional for some of these people.
So that's the reason why I do it, Randy. We've got 5 other doctors in our office, all of us together, And that's the reason why we do it, is that single moment at the end of the day. It's great to work things up. It's great to do all the fancy work that we try to do and be as advanced as we can. But I like doing this. This is my most favorite procedure to do, because in dentistry, it's rare. As dentists, it's rare to say, I can do something that actually changes someone's life. But when they pick up that mirror at the end of the day, it happens. It actually happens. It happens all the time.
They get choked up?
Oh, we have patients that tear up, that cry. We have men that you just see them, all of a sudden their chest is up and they just can't believe it. We have men get emotional. It is the best part of the whole time. It's the climax of the entire day, and it's what my whole staff, everyone is.
Do they ever get choked up?
Everyone does. Everyone
Tears
does.
for the assistants.
You know what? We had a patient that had something done just a couple weeks ago, and he had been in dentures. He'd gone to somewhere, like, once again, dental tourism, gone somewhere and had something done, came back, and things were just falling apart for him. He hadn't had things look like normal in his mouth for years. He'd done some dental tourism, got some work done somewhere else, came back, and things were just falling apart on him. And his wife came in with him for his consult. They came in for a couple of consults. We were able to take out the teeth that need to be removed, upper and lower, give him upper and lower, fixed teeth in one day on 4 implants, upper and lower, and he got 14 teeth. And in general, that day he was happy. He was happy. He's like, I'm excited about this. You could tell he had a skip to a step. Even though he'd been through everything throughout the day, he had a skip to a step. When we brought him to the waiting room and his wife was waiting for him, she just broke down. She was crying. My staff was crying.
Wow.
I just tried to get out of the way. But it's one of those things where, that's why we do it. We do it not just because it's fun to do. We love doing our work. We love being dentists. I love being a dentist. But the biggest part about it is that way that you get to touch someone's life. The fact that they get to say, I have one patient that when he got that mirror at the end, he looked at it, he's like, I'm back. I'm back. And,
really?
And that's a big deal. For them, they've been living their life a certain way for so long. So let's show you another case here, Randy.
Okay.
So this patient, she was a widow. She's a beautiful lady, great lady, okay? She had been married for many years, and she was very embarrassed about having dentures, okay? And she was embarrassed about it because, she was married to her spouse. She'd always been an attractive lady, and she felt that, this was something that she was quite embarrassed about. And I think there's a lot of people that are like this in the world, where they have spouses, and they try to hide their denture from their spouse.
Really?
So they wait till their spouse comes home. They clean their denture when their spouse is not around. They never let their spouse see them without their denture. And this was her. This was her thing. And her husband passed away, and it had been a few years. And she was like, she came in, and she had been a long-standing patient, and she said, you know what, I want to get into the dating world again, but I feel like because of this, I have a secret. I can't date. And I was taken back by that quite a bit, because I thought, well, that's a big deal.
Yeah, yeah. If you're dating and you have a denture.
Yeah. So
good point.
You want to be able to find companionship. You want to be able to feel open and honest with somebody, and that's difficult. So we were able to provide her with fixed teeth in one day on dental implants, and you look at her now, and that's one heck of a smile.
Very nice.
If we look at before and
real.
after, she looks really good, and she's really happy. And you can tell, just like a previous patient, she's got her makeup's done. She's vibrant. She's got so much energy now, and that's what it's about. It's really about, the dentistry's great, but what it's about is that providing patients with that that second chance at life, that ability to say I'm back, and really not have to worry about the things that you and I take for
Now,
granted.
I know some denture wearers. They
Sure.
never complain.
Well, I
Are
understand.
you saying there's no such thing as a happy denture wearer?
Well, what I'll say is there's happy people out there, but Randy, you're not a dentist.
Yeah.
They're not going to complain to you. They're going to complain to me all the time. I'm the dentist. We get complaints every day. And just like everyone out there, Randy, we adapt. And denture wearers, they adapt as well. And like I said before, they don't know any better. They don't know what's possible, what's available. And if you don't know,
So these are current patients, some of these, right?
Yep.
When it's all done, do they ever say, why didn't you talk me into this a long time ago?
well,
Have
what?
they ever said that?
They have said that, and a lot of them said, I wish I had these teeth sooner. I wish I had them years ago. But it's one of those things where we try to keep their teeth as long as possible because they want them, and we try to do what our patients want and make sure that they make the best choices for themselves.
Okay, we have time for like maybe a minute worth of photos.
This is our woman who is an 89-year-old. and we were able to provide her upper and lower teeth in one day for her 90th birthday. And we've done this for someone up to the age of 100, and that's amazing. 80 is not old in dental implant world.
So 89 years old, 90th birthday, she gets teeth.
She gets teeth. She gets fixed teeth in one day, upper and lower.
And they just brush them like regular teeth? They go in for checkups
that's
like
right.
every 6 months?
We just saw
or
her a couple days ago. She came in for her checkup, which she's doing great. She's fabulous. Yeah. There's another one. There's a gentleman that came in, and he was not able to live with his dentures. His dentures were just horrible. He was one of those guys that loved to golf, and he wouldn't go out with his golf buddies after the back nine because he was worried about, okay, we're going to go somewhere. Am I going to be able to eat something or not? And we were able to give him fixed teeth in one day. And he's golfing still, but he's able to eat with his friends and live his life.
Is this true that and maybe denturists could also speak to this, that some people you just never could make them happy with that lower denture? Some people it's just very difficult.
Lower dentures are very difficult. They're very difficult for even if you have a lot of bone and everything else. Remember, the dentures are pieces of plastic in your mouth. They're not locked into anything. Implants at least provide an anchor, something for them to stay in place. Otherwise, they're just skidding around the road. They're just in place, and then when you push down, they get down and they stop when they hit the bone, and that's it.
So at the minimum, would you say to a denture wearer, at least come in and get a fixed arch of teeth on the bottom?
Yeah, that would be fabulous. And it would change the way that they could live their life. They'd be able to eat so many things just with that improvement. So Randy, do I have time for one more photo?
One more.
Okay, so here's a patient. She came to us, and she came to the clinic because she had advanced periodontal disease, gum disease, bad breath, things were bleeding. She couldn't even bite down because her teeth were in the way because they'd moved so much. And she was able to come in, discuss with us what she wanted, and we were able to provide her fixed teeth, upper and lower, on implants, 4 used on the top, 4 used on the bottom, 12 teeth in one day. And look at the transformation. Look at what she looks like now.
Wow.
Look at her smile. She's a whole new person. We see her when she comes in for her consults now, and she comes in for her cleanings. She's a whole new lady. I actually saw her. I just had a restaurant the other day, and she came up, gave me a big hug. That's what it's about. What it's about is being able to let people live their life and really go about it.
What are they happiest or happier about? Is it the new smile, or is it that they could eat anything?
Well, that's a good question. I think that those two are definitely the major points. There's some people that come in and they say, Doc, I want to look good. And it's midlife crisis time, and I want to look good. And then there's some people that come in and they say, Doc, I really don't care what it looks like. I just want to be able to eat. I want to be eat with my grandkids.
Out of pain or whatever.
Yeah, be out of pain and eat with my family and worry about that. But it's funny because when they start off one way, it's funny how the other part becomes so important. When someone who says, I just wanted something that's functional or something that I can eat with, when we start getting into give them those teeth that look really good, all of a sudden they're like, well, yeah, I want it to look like this. And they get into the shade and they get into the color of things. And that's the fun part because now they're getting involved in the aesthetic portion of it as well, which is, listen, like it or not, we all care about the way we look. And we all care about the way that we feel when we look at ourselves in the mirror, and how you present yourself to someone at work or someone that you're dating or even your family. It has a lot to do with your smile.
Well, thank you for coming to the show. We are out of time. So if they want more information, they can go to your website.
That's right, yeah.
Set up a time to see. Do they get to see you?
Yes, they get to see me. It's a no-risk one-on-one consultation, bcperio.ca. It's great.
Okay, good. Thanks again.
Thank you so much.
To watch The Wellness Hour, I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.